Hi guys, welcome back to my channel. I'm Dr. Veena, an NHS GP working in London, and today we're going to talk about the prostate and PSA testing. Let's start by talking about what the prostate gland is. This is a gland that's part of the male reproductive system. It sits underneath the bladder in front of the rectum, and the urethra passes through it. Its function is to secrete some fluid into the urethra that is part of the ejaculate, and it also helps with the speed at which the ejaculate can be secreted out. It does this by contracting the muscle around the gland. Those are its functions. As men get older, the prostate gland does increase in size very slowly. Now imagine if that's what the prostate is and your urethra is going through in between. As it enlarges, it may push on the urethra. So if urine could easily pass through there and now it's narrower, the symptoms that men may face may be things to do with the flow of urine. You may have difficulty with starting the flow or ending. You may go to the toilet quite often to pass urine. You may get a bit of dribbling at the end or a sensation of incomplete emptying of your bladder. Sometimes you may also get aches. Pain is not something commonly that we see, but you get like aches and like a dragging sensation is what men describe. If you have a family history of enlarged prostate or prostate cancer, it's important to mention this to your doctor so that in your 40s, you could get examined with a digital rectum exam, that's a prostate exam, by your doctor in clinic. A physical exam is what we normally recommend as first line before any other tests. Having an enlarged prostate does not necessarily mean you have prostate cancer. It might just mean that there is hyperplasia or increased number of cells of the actual gland, so you may get some of these symptoms. Those cells may never turn into cancerous cells. It may just be benign. The only way to know the difference between benign cells or malignant cells, which are cancerous cells, is by being referred to a specialist where you may have an MRI or biopsy that will look at the cells under a microscope to then really define what they are. What is the PSA test? The PSA blood test stands for prostate-specific antigen. The name has specific, however, it's a very non-specific test. And this is because it can lead to a lot of false positives and a lot of false negatives. If 70% of people test positive with the PSA, evidence shows that 70% of people who test positive on the PSA don't have prostate cancer. And of the 30% that test negative, may have some changes. So as you can see, it's not a great test, and that's why it's not something that we kind of push. But if it's something that you're considering because of a specific family history or you're having new symptoms, it's something we can definitely do for you on the NHS. The PSA level varies with age, and that's the parameter we use to decide, does this need onward referral? If you have a high PSA level, you will be referred to a urologist who's a specialist who will then look into getting an MRI like we discussed, and if needed, a biopsy to then decide what happens next. Things to do before your PSA blood test. Because this measures the rate of a specific antigen released around and by the prostate gland, you don't want to do anything that would overstimulate the gland. So for 48 hours prior to your blood test, you don't want to do any vigorous activity that would stimulate the groin. So no excessive squatting, running, no ejaculation, no sexual intercourse, 48 hours prior to the test. If you have a current urine infection, wait until it's completely treated for at least a week before you do the blood test. If you've had a physical examination by your doctor, a DRE, a digital rectal exam, again, you have to wait a while before you actually get the test done. Currently, there isn't a national screening program for prostate cancer in the UK, and that's because of a lot of reasons. It is, in a lot of cases, a very slow-growing cancer, which means that we often end up overdiagnosing, overtreating with overcomplications for patients that may have had a very good quality of life, even if they didn't know that was the case. There are lots of parameters that have to be met for a specific cancer to then enter and become a national screening program. So this is something else to also keep in mind. Having said that, if you have a first degree or a second degree relative who had prostate cancer or prostate complications, and you are a man in your late 30s, 40s, 50s, and it's something you want to discuss with your doctor, please feel free to do so. I'm going to leave some links below about PSA testing, prostate cancer, general prostate enlargement. If you have any specific questions, please feel free to write them. I'll do my best to answer them. But remember, we can't give specific advice about your health. We can answer specific things about the condition. Thank you so much for tuning in.